One problem we see with some frequency in chiropractic is commonly called a frozen shoulder, and that's where somebody tries to lift their arm. They'll commonly be able to get to about here, about level, but they'll have difficulty trying to elevate their arm the rest of the way, and they'll usually have difficulty trying to put their arm behind their back as well. A lot of times they'll get their hand down to their hip but not be able to go any further. I think most people would assume that that is purely a shoulder problem and may not think of chiropractic for frozen shoulder, but the nerve that actually controls that shoulder going from 90 degrees to the rest of the way up comes out of directly from the brain. It's the cranial nerve number 11, comes through a hole in the base of the skull and then into the soft tissue at the base of the neck, and supplies the trap muscle, which is this big muscle here that allows the arm to elevate. And when there is a compression on that nerve, it can affect that ability of that neuromuscular action to occur, and it leads to what we may call frozen shoulder. Now, the longer that's there, the more likelihood there actually is fibrous adhesions or things that develop in the joint. But when we see somebody early enough, we're typically able to get the pressure off the nerve, and as things are getting better, give any type of therapy and things as well to make sure that the soft tissue gets its mobility back and get very good results, either complete return to normal, or sometimes there may be some mild limitation left within a few months there, but generally good outcomes without any surgery, injections, or those kind of things. So if you're dealing with frozen shoulder, if you know anybody dealing with frozen shoulder, I would start with chiropractic first for that, prior to just active therapy, and certainly prior to any type of injection or surgical release or anything like that. I would look for a chiropractor who deals with frozen shoulder. I don't know that everybody would necessarily do that, but I think most good docs out there would be able to help with a frozen shoulder. So hope this helps. Thanks for watching.